Good evening for all who are in East Africa, for the other people outside of the East Africa. Good morning for others, good afternoon, for others, good evening. So welcome to our webinar. This is ISSUP Tanzania. Our webinar is about festival health season, substance use prevention during the holiday season. And we have three presenters. The first presenter is Dr. Kassia Nyandindi. The second one is Dr. Rugemalila. And the third one is Ms. Damali Kabwali. Before starting, I would like to know if all people are hearing me right now. So you can open up your mic and say something if you hear me clearly. Everyone, do you hear me clear? If you...
Yes, yes.
Yes, okay. So I can proceed. First of all, I would like to provide my sincere gratitude to all of the people who have taken your time to join us today. This shows the commitment to support young people, especially in the area of substance use in our community. And before proceeding, I would like to highlight the biography of our presenter. The first presenter is Dr. Kassia Nyandindi. This is a psychologist and an assistant commissioner for treatment and rehabilitation services at the Drug Control and Enforcement Authority, DCA of Tanzania. He also served as the chairperson of International Society of Substance Use Professional Tanzania, ISSUP. Dr. Nyandindi is a global master trainer for the Universal Treatment Curriculum, UTC, and Universal Prevention Curriculum, UPC. But also he holds ICAP 3 as an expert. He played a key role in strengthening national substance use prevention, treatment, and rehabilitation strategies with a strong focus on youth protection, public awareness, and community engagement. But also with Dr. Isaac Rugemalila, is a psychiatry and the head of mental health department at Benjamin Mkapa Hospital, as well as he is a secretary of International Society of Substance Use Professional Tanzania, ISSUP. He's a global master trainer for UTC and UPC, also holds ICAP 3. With intensive clinical training and public health experience, his work focuses on adolescent, women, and the community affected by substance use. But also we have Ms. Damali Kabwali. Ms. Damali Kabwali is a social worker with more than 15 years of experience in HIV program, and is specific with the people who inject drugs. She is currently serves as the head of program at the Tanzania network of people who use substance, TANPOD. Also, is a member of ISSUP Tanzania. She has been an instrumental in establishing and strengthening harm reduction services across Tanzania. So I think right now, at least you have a profile of those three key speakers, and we can start with Dr. Kassia Nyandindi to provide a little bit of history about the ISSUP, Global ISSUP Tanzania, about Drug Control Enforcement Authority, and he can start our motion today. Welcome all.
Yeah, thank you very much, Shabani, and thank you very much the entire ISSUP team which has managed to coordinate this webinar today. A point of correction, I'm a psychiatrist, I'm not a psychologist. But today I'm not feeling very well. I have some flu, so I'll take you through the introductory party, and the rest of the party will be communicated to you through Dr. Isaac. So thank you very much. Before I start, it's very important to understand the motion today that we as Tanzanian ISSUP chapter, we are talking about we are talking about our chapter. So our chapter was officially launched in 2023. And as a country, We are from Africa, and we are the 10th largest country in Africa. And we have an area of around 947 square kilometers. And our current population is Tanzanian, is estimated to be around 62 million people, with half of the population being people below 30 years. So today's session is very, very important because the youth contribute a significant party of our population. When you look at our geographical location, we are bordered by 8 countries, which are Burundi, Rwanda, Democratic Republic of Congo on the west, while on the northern party we have Kenya and Uganda. When you look at the southern part of our border, we have Malawi, Zambia, and Mozambique, and we have the Indian Ocean on the east, which contributes significantly to the influx of a lot of substances in Tanzania. So our Tanzanian national chapter started officially in 2023. So now we are just like 2 years old. You can go to the next slide. Go to the next slide. So our Tanzanian chapter is just 2 years old. We started in 2023. And our chapter is anchored through the Drug Control and Enforcement Authority. So this is the organization I'm working with right now as the head of treatment and rehabilitation. And the idea was to anchor the chapter through the government agency in order to address the issue to all key stakeholders, including non-government actors and government actors. And our authority is responsible in addressing the drug problem as a whole, whereby we are responsible for supply reduction, demand reduction, harm reduction, as well as enhancement of cooperation, starting from local level, national level, as well as at the level of the international. So since we started up to now, we have managed to recruit or register 196 members of ISSUP, and we have been able to train people in through different programs, including prevention programs on evidence-based, but we have done a number of treatment and rehabilitation program, and we are also carrying on training people on recovery program. I mean the program which is responsible for the recovered drug users in order to equip them with evidence-based intervention skills. So next slide. As a Tanzanian chapter, we have our own organogram whereby we have a board. So there is a big board up there, and I'm here as the country director. But below me, there is Dr. Isaac, who is the general secretary, and Dr. Isaac is one of the panelists today. So we have our key 4 strategic areas. We have the head of development and training, and is responsible in organizing all these training. And again, we have the head of public relations, we have the head of fund organization, and we have the head for students and youth. And Shabani is doing quite a lot on this area, and it was one of his idea to come up with this webinar during the holiday in order to help our youth to understand very well about the drug problem and how to cope with it. So I'll be taking you through the global picture. We are trying to look at the global, regional, as well as the national trends on substance use. So when you go through the UN report, you'll come to realize that worldwide, more than 300 million people have been using drugs globally as per 2025 World Drug Report. But 28% of them are over 10 years, and they've been using drugs, while 64 million people have been diagnosed with drug use disorders. I'm talking about those who have been affected to the extent of having drug use disorders. And 13% of them have over 10 years have been using drugs. So when you look at this report, the report covered people of the age between 15 to 64 years. Now, the report explains further that 29.6 million people, adolescents and young adults aged between 10 to 24 years were affected by substance use disorder globally. So this is a very big problem among adolescents and youth, and therefore we feel it's very, very important to talk to the youth, to give them evidence-based knowledge on how to address drug problems so that they can come up with different coping strategies in order to stay away from this problem. So majority of people tend to start using drugs at the age of teenage, and therefore study shows that illegal drug use is very common among teenagers, and most of them, they tend to start before the age of 15. And when you look at the science, you'll come to realize that the brain of a human being grows to maturity by the age of 20 to 22. So when someone introduces himself into drugs at a lower age, then most of them, they will tend to have more complication compared to adults. Therefore, it's very important to address this issue to youth. And alcohol and drug use is very common among adolescents. A lot of adolescents start drinking alcohol at the age of 15 to 19 years in a lot of countries, and the report shows that around 155 million adolescents have been introduced to alcohol by the age of 15 to 19 years. So the prevalence of episodic drinking among adolescents aged 15 to 19 years was 13.6% in 2026, and the risk is much more higher in males compared to females. But again, cannabis is the mostly widely used psychoactive drug among young people, and about 4.7% of people aged to 15 to 16 years have been using cannabis in 2018. Therefore, alcohol and drug use in children and adolescents is very common, and it is associated with a lot of neurocognitive alterations, which lead to behavioral changes, emotional changes, a lot of social problems, as well as a lot of academic problems. So a lot of parents, a lot of community members, they just see the behavioral changes among youth. They see youth suffering from a lot of emotional problems. They see youth suffering from a lot of social and academic problems, but to majority of them, the underlying factor is drug problem. So this topic today is of paramount importance, especially to the community, in order to speak to the youth. And we know now it's the holiday season. A lot of them are back home, and it's high time to talk to them about alcohol and substance use. Now, my other slide, I would like to take you through definition of terms, and we'll be looking at three terms. We will try to define the psychoactive substance, substance abuse, as well as substance use disorder. So when we talk of psychoactive substance, this is any substance that affects the feelings, perception, thought process, as well as the behavior. And we know when someone takes this substance, they will affect the central nervous system, and then these people will be affected in all those key parameters. But we as community members, most of the time we tend to see the behavior and we forget that these substances can also affect the feelings, perception, as well as the thought process. And when we talk of substance misuse, we refer to the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. I'm trying to emphasize the point about alcohol because in a lot of community members, and because of our cultural adaptation and cultural experiences, we tend to forget that alcohol is also a substance. So misuse and diversion of prescribed controlled substances is also very common among youth. We see a lot of them misusing stimulants. They also misuse the other central nervous system medications like depressants. We see misuse of opioid analgesics like tramadol and pethidine. So again, these are also common substances which are being misused. Now, the last definition for today is the substance use disorder. And when we talk of substance use disorder, we are talking about a condition whereby substance lead to significant impairment or distress involving a compulsive pattern of using substances despite harmful consequences. So an individual with substance use disorder, they will be using substances despite the fact that they know the consequences associated with substance use. And these substances will later on affect their health in terms of suffering from a lot of health conditions, including mental problems. Some of them might succumb into different infectious diseases like HIV, hepatitis, but again, we also see tuberculosis among them. But again, the social life will be impaired, work life will be impaired, and most of the time when people use these substances, they will develop a condition of increasing the amount of substance they use. And here I'm talking about the tolerance. That means they'll be using higher substances to attain the same level of pressure they were using before. And people with substance use disorder, most of the time they tend to suffer from withdrawal symptoms. And these are the conditions which occur when they miss the substance they are addicted to it. And the rate of effects will range from mild to severe, depending on the nature of the substance and the physical health of the individual who is affected to these substances. So that was the introductory part. Then the second part will be carried on by Damari. And because of my health situation and my voice, I'm not feeling well. So the last part, which I was supposed to present, will also be presented by Dr. Isaac. So thank you very much. And Damari, you can proceed from there. Thank you.
Okay, thank you so much, Dr. Cassian Nyandindi. Before Damari, if you have any question, any concern, don't hesitate to ask it through our chat box. If you have any question, any concern, put it in a chat box. As Dr. Cassian said, a lot about statistics, about the meaning of psychoactive substance, about the meaning of substance use and misuse, the issue of SUD. We need to be aware that during this season of festival, many people feel the time for joy, celebration, and social connection. However, many research shows that this period can also increase the risk of first substance use among young people. Factors might be increased social gathering, peer pressure, availability of substance use, and the reduced supervision that people make in this holiday period. So let us hear Ms. Damari. Welcome, Ms. Damari. Ms. Damari, do you hear us? Ms. Damari?
Yes,
And the doctor?
yes, I'm hearing you. Thank you very much for the presentation from Dr. Cassian. And as we have seen our topic regarding the use in this time of festive, we know the prevention for substance use. And this has different interventions so that to help for our youth to prevent or even the community entering in substance use. So I will go on right snap on about prevention and how it could work according to different groups, and how in this festive season we can help and discuss issues with our youth or even our children or adolescents regarding substance use preventions. And as we know, prevention is application of prevention science to address the health and safety of individuals through improving socialization, and it is a process, and it meant to enhance the self-realization and the participation in the society. As you know, prevention is the science. So if it is the science, it's based on health education, health promotion, as well as it is prevention intervention that will encounter in helping in preventing people to enter in substance use. And all of the goal is to improve the public health. And as we know, if we are not preventing, public health will be in danger, and we will get a lot of problems as we hear from substance use disorders, which were shared on social health and some economic issues. So this prevention, it might assess its efficacy and effectiveness in prevention. So the importance of which is that it will help people and young people to avoid or delay the initiation of the substance. If we start the prevention, if we start the education, if we start the promotion to youth, it will delay or prevent effectively for them to enter in drugs, because they'll have knowledge, they'll have skills, and they'll understand the consequences in entering substance use. So it is better to start early. And also the importance of this, it concerns to the health and safe development of the children and youth, to realize their potential and become contributing members to the community. As we know, these children are growing up. These children are the future. So if we not prevent them ill, if we not educate, it might not be a good future for them, even the society, even the community and the family level. So we have to do it as early as possible for them. So it is very important to start at early. So there are some theories that can be used in prevention interventions that can support or help us to conduct these prevention interventions. You might find there are some three, the basic one, which is universal, indicated, and is selective. So when you want to do prevention intervention, for example, for the universe, you can apply this approach through or theory by selecting all the people, all mixture of all the maybe the targeted population. For example, if you wanted at the school level, you will need all the students, or at a certain classroom, so you can just provide a prevention educational intervention to all the school. And indicated for those who may have already initiated. So there are, you might find in a certain group age or children or youth, there are those who have already started, like maybe drinking alcohol or smoke marijuana. So you can select also some of them, and you can imply the indicated so that you to help them, so to avoid further distraction for them, which might be caused by substance use. And also you can do selective for those who are vulnerable. You might find those who are in a high risk, or they've started long time, some have started to develop independence. So you can find on our way to support or help them so that they cannot maybe get more problems or avoid or reduce those harms. Those are the theories that can be used. So also in prevention, there are some development framework on how to implement or to work on them. And you can find, especially for this youth group, we can find a way. There are different categorization of interventions and policies that might help to implement this prevention. You can have the framework regarding on infants and early childhood. As we know, this, for example, if the community is there is high using maybe of smoking marijuana or alcohol, you might find even the children are getting affected, or some they start very early at their childhood. So you can find in the way like that. Also in the middle, children, those maybe at least started to go to school, some they try, or when they see a parent using, some they can start to use, or just try, or to just pray on it, so you can find a way on how to intervene to this. Even early adolescence, as you know, the adolescenthood, there's so many tries, there's so many issues, so many problems, so many peer pressures, so we can intervene on how to work according to their level, maybe sexual, gender, or according to the issues in a certain community. Also, there are adolescence and the adulthood, especially when they are coming from adolescence age to adulthood. Most of them, they see they are already grown up. So they have a way on how to discuss, to share, for them to understand it. And the setting can be different for this youth. You can find these children or youth there in the different areas. At the family level, there is our own way of providing, maybe educating the parents or the caregivers or the guardians on how to take care of their youth and the children. At a school level, because most of the time youth, they spend time in a school, so you can even train teachers or administrators, or you can find the counselors on how to discuss or to share this issue with their students. At workplace, you might find there are some communities or society, children are starting to work well, or they engage in child labor. So, and in some of them, you might find they engage in this substance use. So you can find a way on how to work with them. Even at a certain community, according to their culture, to their more customs, and maybe traditional, you might find some kind of substance they are illegal to their community. And when those adult people started to use, even the children, some they see it is illegal, they can use it, like smoke or drinking local beers, so issue like that. So there are different settings that you can intervene through this prevention, as you have already discussed at family level and school-based prevention. So there are some practical actions that you can do so that to avoid this youth, or according to a certain area, on how to prevent them from drug use or substance use. For example, to persuade, you can use the persuasion theory. For example, maybe to try to hear or to say, to share their idea to the either parents, guardian, or school administrators or school teachers, for them to understand all the authority, why we should intervene, or why should implement this prevention intervention and its outcome and the objective, and how they should be engaged. So the implementation also, it will depend. You can create like a plan, a timeline, benchmark, long term when they have, and short term what will be done during the implementation, roles of each other, for example, a parent, a teacher, or administrator, or head of the school, or the manager, so you can find a way on how to work. But the implementation also should be clear and be understandable, especially for those who will going to implement even the school. For example, at the school, you can create a school policy regarding substance use. If somebody has been using drugs, what will be done? At the school policy, what it say? Are they chasing them, or just taking them to prison, or they just support them, or help them to quit, or help them to reduce more harms? So we can, during the implementation, this is the area where we can plan and see how to do it. Confirmation, to recognize the policies and the procedures that has become standard in a certain community, maybe school situation. This will help to understand, even the community will know this, maybe we have been planned this, it can be done this, and the policy say about this, and how to overcome such a problem. So these are the issues that at a school, like a school personnel, the team at the school, physical setting, program, curricula, policies should be there to support the prevention. Even the climate at school, sometimes the climate at school, it is affecting much of our youth or the children. Maybe there are nearby bar, or there is nearby night club, or there is a hot spot where people are using drugs. So some school students might learn through them, or they can just want to try, or escaping from the school. So there are so many issues that might affect the youth. Even at community, there should have prevention intervention. As you know, the community, some of the area they need a lot, like there is the governance, those who are reading, what should they know, how they could participate. Family level, what is the role of a parent, a guardian, even a child, how himself to understand the issues and effects. Even the economic is, there are some economic reasons that affect the children to enter in drug use or substance use. So also should be identified so that to see on how to intervene, especially to protect the youth and the children. Even religion, safety and security. So those are the issues. So also those are the issues I can share. And thank you very much. Maybe I can ask Dr. Isaac to continue with the other session. Thank you.
Hello. Can you hear me?
Yes,
hello?
Yes, hello.
All right.
Yeah.
All right, thank you very much. So we are going to the other part of it, and we are going to see how the festival seasons, holidays influence youth and the way they engage in substance use. As they introduced me, my name is Isaac Marira, and I'm a psychiatrist. Okay, so we are good to go. Next slide, please. Okay, so as we know, the holiday seasons, there are seasons for which we do experience a lot of celebration, joy, and of course, I think might be a global thing, but in our setting as well, we have intense of these events around late November to early January. So we have Christmas, we have a New Year celebrations, and we'll see a lot of decorations, a lot of parties, gift giving. People take vacation from their in their holidays. They take time off from work. Some of the people engage in cultural traditions. As we see in Tanzania, it's very common for some of the tribes to go back to their village and have celebration there with other fellows. So really a time where also people do a lot of shopping, a lot of social gathering, meeting for funds, and this also comes with breaking of a lot of routines, and sometimes it might be very overwhelming, especially to youth because of what is going on. And this is also the time that most of the youth, they take holidays from their schools or even universities, or be it the days school setting or boarding school setting, and they tend to meet their peers in their villages, on their homes, and their societies and families. So and they create new friends, new connections, they meet new people, and so a lot is happening in this time, and youth show up with different things, like they have new stories to tell, they have new fashions to show and to learn as well. So they experience these things, and really they, in one way or another, they impact their lives. Next slide. Next slide, please. Okay, so you see, all of this also comes with the consequences of risks. So we look from the family level. There are risks that comes with these festival seasons, and like people are coming back, or they are coming to celebrate these seasons, and then the key point here is socialization. But then, if the family has not been in a position to integrate and define how socialization should be, then you might find this might, in a way, affect the way the youth perceive or act in this manner. So let's say youth have gone to the village and they're meeting new people out there. And then they find maybe youth in that area, or they find that taking alcohol is something that is cultural down that place. So if the family has not put some rules or has not explained how the socialization should be, particularly in this period of time, it's easy for youth to see or and copy what others are doing. So they are going to the village, and then they are seeing their uncles, their aunties, alcohol, and no one is prohibiting them. Then it's very easy for these youth to engage in alcohol use. I think this is one of the vivid examples that we are having in Tanzania, that so also youth do engage in alcohol or taking substances when they are exposed to other family members who are taking alcohol or taking drugs. But also there's the issue of peer pressure. Now, youth are coming with a new behavior, new practices, new fashion. You know, I have a friend who is smoking cigarette now because maybe he's 19 or he's going to a college and they're not really restricting taking cigarette. And then they meet this person at their home environment. They see them taking cigarettes or they see them taking drugs. So it's very easy sometimes due to peer pressure for youth to be persuaded or to engage in substance use from that end. But also there is issue of psychological problems, you know, like, you know, at this time youth see other adolescents or other youth engaging in making relationships, might be the intimate kind of relationship, you know, and these youth now growing up, they want to practice and experiment new things. So this psychological pressure also might, in a way, if at all there's no direction, there's no good instruction, there's no good clear set out rules, okay? It's easy for them to engage into or copying what others are doing and engage into use. The issue of schools as well, you know. I remember when I was in secondary school, the holiday time is the time that you want to really watch what was going on in school, you know, tight schedules. You have some difficulties, maybe you didn't like the food out there, you didn't have time to explore things. So sometimes you tend to come with the negative issues from their schools, and sometimes they learn new ways of coping with these negative issues because they go home and they share their stories. Other youth are teaching them some new ways of coping, and some of the ways might involve taking drugs. So this is one of the ways that we need to see how we can intervene. But we have youth who are engaging now. They're at work, and so they learn new experiences at work. And they go to parties, to celebrations, you know. They have money now. Maybe they're exposed to things that at their age might be a bit too much, or new skills and experience, and maybe they have not enough knowledge to kind of like help them to balance the work-life balance, the work-life the work-life balance. So it's so easy sometimes. This might come with expense of introducing them to substance use, and then find themselves using drugs. We know now there's a lot of influence from the media, you know, media showing different, especially to our setting where there is no, I would say there's not a lot, I mean, enough restrictions to what the media is portraying to the public. And this also put youth in a situation where they might learn these things. And when it comes to festival seasons, you know, there are a lot of fashions, new styles, you know, a lot of products that are displayed. And the product might also include drug and substance use, you know. So it's very easy for the media to influence the behavior of the youth. Yes.
Dr. Isaac, sorry, there is some noises in your background. Are those noises from your background or from participants? If from participants, make sure you unmute. You mute your microphone. Make sure if you are a participant making some noise, mute your microphone. So Dr. Isaac, proceed.
Okay, thank you. Okay, so the last is the community setting. I will give example of a situation in Tanzania whereby certain tribes they will go to, they will gather, like example from my tribe, they will gather, and one of the way they do the gathering, the social gatherings, particularly this time, is to share or to take alcohol. You know, so you will see how youth are pressurized to engage into substance use. And because this is a cultural thing, it's a traditional thing. And if there's no enough knowledge and awareness, it's very easy for youth to engage, because maybe the tradition doesn't really provide a way to say, maybe we don't allow youth to take drinks. But sometimes our tradition do encourage youth to take drinks as part of the society. So these are the things that particularly intensified in this festival seasons and might pose risks to youth to engage in substance use. Yes, and maybe prolong the substance use. Next slide. Next slide. Yeah, so as a way of really preventing or sharing this message to alter the risk of substance use, particularly to youth, I think generally we need to look on 3 areas that we need to intensify our communication, particularly during these festival seasons. The knowledge and skills. Youth particularly have to be informed on this about the substance use and how the risk of engaging substance use, the environment that can perpetuate substance use or influence youth to engage in substance use. We really need to communicate or instill enough knowledge and skills. They have to be aware of their environment, aware of the traditions, aware of the things that might look normal or might be normalized in our community or in school environment or in this festival season, but also pose a risk to youth, especially when it comes to substance use. So youth have to be knowledgeable and given skills. The skills might also be like maybe saying no when it comes to they find themselves being exposed to this environment and maybe influenced or persuaded to take alcohol, to take drugs. So the knowledge and skills is very, very important. Knowledge about substance use and skills of how to prevent themselves to engage in substance use. But also, we have to understand the peer dynamics. You know, if you read the psychology behind adolescent, then you will know that the peer influence is part and parcel of their life. You know, so we need to understand how the peer dynamics influence others' peer behavior and their practice in daily life, particularly in these celebration times, in these party times, in these festival holidays. So we really need to teach how the other peers might influence, particularly those who are using drugs, might influence those who are not using drugs into using drugs, plus the knowledge and skill that we have already exposed them to. I think it will help them into reducing or stopping them into next step in this drugs. But also at the family level, our family has to be informed. You know, as I say, some of the traditions do support substance use, particularly in this festival season. So we really need to inform the family, to inform the society, to advocate about the risk of substance use. Might be a tradition, but also to be clear that this might pose a risk to our youth, and also influence them prolong their substance use and maybe find themselves having substance disorder. So having enough knowledge and skills to particular to youth, understand the peer dynamics, and making sure our families and society are equipped enough to assess the risk, and also to make better choices for our youth. I think these are the very important communication tips during this festival season. Next slide. Next. Yeah, we really need also to emphasize on and communicate on psychological support. As we say, during this time, youth are meeting new people, are forming new relationship. You know, they're exposed to other things that they might not be used to. So we need to understand and to provide psychological support. And sometimes when youth are seeing other youth doing something, maybe it's a fashion, they think maybe taking drugs is fashion, and there's this peer pressure, psychological pressure, and sometimes they might feel like they are left out. You know, they're not part of the bigger picture. They're not part of the celebration. You know, they're not part of this holiday season. So being able to understand them and to empathize with them and explain and support them psychologically to choose the better way, I think might be very helpful. Also, school life. I think we really need to understand that school life influences a lot on the youth behavioral dynamics. So we need to have to implement what Damari has already mentioned. You know, to implement the school policy on drug use that will support our youth not to engage in drugs, create a school climate that is not supporting the drug use, particularly in school life. It will help us to prevent youth from drug use, and at workplace as well. I think these things have already been mentioned. We need to have programs, to have policy, to have environment that does not support. Next slide. Next slide. Yeah. Environmental intervention, I think this is very important. You know, if you look at our community, you'll see that most of the festivals, most of the events that are involved in the festival holiday seasons, the substance use might be one of the activities that is being portrayed. So we need to have environmental intervention in a way that maybe teach our youth to enjoy during this time without involving substance use. So create things like drug-free dances, you know, drug-free gatherings, drug-free maybe clubs, you know, when they go have good music, but at the same time, the substance is not at the center of this celebration. So environmental intervention, community intervention goes in line with the community interventions and media intervention as well. to remove drugs out of the picture, you know, and making sure that our youth are safe and can enjoy these holidays without having influence of using drugs. If at all there's influence, then they can be able to make a better choice or a good choice of not engaging into substance. So having restriction also on who can, I mean, in our places where people go for celebration, not to engage youth into substance use. Have a strict restriction that maybe people below this age, they're not supposed to take alcohol, they're supposed to take drugs, and be sure that those programs and preventive intervention are implemented to be very helpful to us. Next slide. Next slide. Yeah, so in conclusion, I think we will say when we are emphasizing on what to communicate in this time to parents, to families, and to youth, then we should make sure that the families have secure mechanism on that will prevent youth being exposed to substance use. So making sure we lock up or remove alcohol when there's a presence of youth in our family settings. Yeah, making sure we have set rules and have conversation about the risk and expectations that the family is expecting youth not to engage in substance use, and making sure that we supervise and engage in these activities so that all our activities that are engaging youth, then there should be a substance free kind of event. But for youth as well, we should teach them. We should make sure we instill enough knowledge and skills, and especially ability to say no when they are exposed to environment, when they are influenced or they are triggered to use substance. But also to have a mechanism where they can seek support when they think they are overwhelmed with or pressurized to take substances, and they can prioritize their self-care rather than engaging this maladaptive kind of a behavior. So if they engage in sports or they meeting new people, they should be able to reach out when they think they're in a situation that is more risky. So educate, we should make sure we educate our community and also provide support to make sure we alleviate the risk of use or using substances. So this is the end of my presentation, and I invite, if at all there is questions, need to be responded. Thank you very much.
Okay, thank you so much, Dr. Isaac. I provide my sincere appreciation to Dr. Isaac, who did a nice presentation. Discussed there a lot about substance use to youth, and he tried to focus on peer pressure, how peer pressure influence youth to enter in substance use, especially during this holiday season. Tried to explain the role of parent to prevent substance use, but also tried to explain to us about how parent can ensure to provide huge supervision during this period, the issue of parent to provide a quality time to speak with their children, but also to remove all availability of alcohol and other drugs in their places, also to talk, to educate their children about refusal skills. How can they reject the temptation? How can they reject the peer rejection? How can have the ability to say no? So a lot of things have been discussed here. So I would like to invite questions, and many questions are posed by participants. So Dr. Isaac, I think you are here. Dr. Cassian, are you here? I want to to read the questions. So I want to ensure presenters are here in order to assign those questions to speakers. Dr. Isaac, are you here?
Yes, I'm here.
Dr. Cassian, are you here? Dr. Cassian? Okay. Miss Damali, are you here? Miss Damali? Okay. We have only Dr. Isaac right now. So Dr. Isaac, you will answer all of the questions. Are you comfortable?
Yes,
Dr. Isaac?
I am. Yes, I am
Okay.
comfortable with that.
You're comfortable. So I will start with the question number one. The question number one from, let me go down. I will ask the question, then after replying the question, I will provide an opportunity for participants to contribute. So let me start with the question number one. Okay, question number one was from Idrissa. Idrissa asked that, do you have any idea about Kush, the drug known as Kush, that is destroying the lives of youth in Sierra Leone? I heard you talking about other drugs, but you didn't measure the Kush. This Idrissa from Sierra Leone, in their country, there's drug known as Kush. So from your presentation, he didn't hear you say Kush in any place. So this kind of drug is found in Tanzania or not, Dr. Isaac?
Okay.
Dr. Isaac,
thank you very much for. Yeah, thank you very much for the good questions. When we talk about drugs, they are also really present in different forms depending on the setting. But what we see here, or what we are trying to discuss here, is more for pharmacological. But this falls into psychoactive drug rather than the name of the drug. So we have like thousands of drugs, particularly now when we have these new psychoactive drugs, and they come with different names. Like here in Tanzania, cannabis has more than 10 names. So sometimes it depends on where you're from. If you're coming from the northern side, they might have they might name cannabis as Kush as well. So what I'm trying to say is, I'm not very sure if the Kush we have in Tanzania is the Kush we have in Sierra Leone. But with the little knowledge I have with what Sierra Leone have as a Kush, I don't know. I don't know if it's opioid or it's a synthetic cannabis. I'm not sure about that. But if it brings a lot of effect, it comes to a point where we might say this is a psychoactive drug and it might affect you. For example, here in Tanzania, Kush, which the original name is cannabis, is one of the gateway drug to youth. A lot of youth are using cannabis, and we have seen massive psychological and health effect of cannabis. So what I'm trying to say here, or I think the best way to respond to the question is, I'm not very sure if the Kush in Sierra Leone is Kush we have here in Tanzania, but also in Tanzania, cannabis might be referred as a Kush, and it has affected most of the youth who are exposed to such. I think I made sense out of it.
Isaac.
Yes.
Dr. Cassian, proceed.
Yeah, thank you very much, Isaac, for the very good explanations. We are all aware that these substances are being named differently depending with the geographical location. But as far as Kush is concerned in Sierra Leone, I may not be 100% sure, but I met with one person from Sierra Leone. So they told me like kush is more of cannabis, but at times it is mixed with some other substances in order to have some more effects. It's like on this side we have skunk, and sometimes they mix skunk with other substances, including NPS, in order to have much more effect. So from local perspective, we can have just those names, but if you want to understand the pharmacological effects of those substances, like what Dr. Isaac said before, you need to take them to the lab in order to do proper tests, in order to understand the chemical ingredients and the possible pharmacological effects and physiological effects to an individual. So we can't rely 100% from the local name of a given drug without taking it to the lab for further tests. So thank you.
Okay, thank you. We have another question from Pietro Cipolla from Italy. The question posed to Dr. Cassian. And this person asked about the formulation of ISSUP Tanzania chapter. He said that what are the advantages and the disadvantages of having ISSUP chapter in Tanzania established within a government body? What are the advantages and disadvantages of having an ISSUP chapter established within a government body?
Yeah, thank you very much, my brother from Italy. I know him and I'm glad to hear from him. We as Tanzanians, we decided to establish our chapter within the government entity because of the issues of sustainability and issues of integration. Because at times when you introduce a chapter, let's say into an NGO, the movement, the adaptability, the acceptance, but at times the way how you work with different stakeholders might be difficult. So we opted to do it through the Prime Minister's office, because we know the Prime Minister's office is the executive ministry and the rest of the ministries are working under it. So in terms of integration, it's very, very easy. And I would like to tell you that we have been operating so easily compared to if the chapter would have attached itself to a local organization. The only disadvantage which I can see out of that, sometimes when you explain to people like the chapter is within the government institution, they feel like other stakeholders are not involved or are less involved. So that is the picture where other stakeholders might think, especially stakeholders from outside. But for us, it's not like that, because the chapter is anchored within the Drug Control and Enforcement Authority, and this authority has got a specific division which deals with issues of prevention, treatment and rehabilitation, and all stakeholders collaborate with the Drug Control and Enforcement Authority in terms of addressing drug problem, including non-government organizations, civil society organizations, and the community at large. So that's the situation, and that's how we operate. So thank you.
Okay, thank you. But receive another question from Brenda Mbati. He tried to ask about how can we balance individual freedom with public safety in enforcing drug and alcohol restriction during festivals, because a person has a freedom to do anything he wants. So how can you, from Drug Control Enforcement Authority, from ISSUP chapter, can balance individuals' freedom with public safety in enforcing drug and alcohol restriction during festival? Maybe a government can provide different announcement on how can people celebrate their holiday and other stuffs. Proceed, Dr.
Yeah,
Dr. Carson.
I will start and maybe Isaac will add. The question is somehow complex because he's asking about individuals. Our today's session was centered very much to youth, and we were discussing about substance prevention for youth, and we know as far as the law of many countries, youth are not allowed to use these substances. And so from the side of the law, that one we know the law works perfectly because youth are not allowed. Now, since the question focuses on people in general, literally you cannot force someone to stop using alcohol. Our mandate and our role is to talk to them. We give them like evidence-based education about different choices they make, what they need to understand, what kind of precautions they need to do. And from there, you can't force someone. People have got their own choices and they can do whatever they want. We, as public health specialists, as substance use professionals, our role is to impact them with evidence-based knowledge so that they understand, because some people succumb into certain situations because of illiteracy and lack of knowledge. But I know the law of the land avoids or stops people, especially the youth, from using drugs. The law can be very forceful to the youth, but not to the general population. So let us work as public health specialists. Let us work as substance use professionals in terms of working within our professional code of conduct, rather than trying to enforce them as if we are working like paramilitaries or police. Yeah, so thank you.
Okay, we have another question from...
If anyone wanted to ask more on to add on top of what I said, they can chip in and add. So that was like a break of the ice. If anyone has got any other input, they should feel very free to add some more information on that. Thank you.
Dr. Isaac, do you have any additional before moving to another question? We have a few minutes remain, at least.
Okay.
So continue.
Yeah. So I think what Dr. Carson, the response from Dr. Carson is very clear. The question was a bit, has more than one side, and I would say the personal freedom is much taken care in a situation. But then, like for those who by law are allowed to drink, because the laws and regulations are very direct, that youth are not allowed to drink or to take alcohol, especially if they are under 18 years of age. But also to those who want to exercise the freedom, there are always designated places where they can go and access maybe the legal drugs that are allowed in our country. So still plus the personal freedom, still there are laws and regulations, and some of the law and regulation are very strict on substance use, particularly to youth. So it's a matter of, it's a question of balancing about the law and regulation plus exercising personal freedom. So I think this is what we experience here. So we can't really go beyond what we the law and regulations are portraying or are saying or are instructing us, and say we would exercise our personal freedom beyond what we can do. So I think it's a question of balancing rather than, yeah.
Okay. Thank you. We have 15 minutes. We closed our session, but let us provide 10 minutes for more questions. Here with the question from Good Luck Rahim, said that where is the best place youth can learn about drug abuse, effects, and prevention? Is it at school, at home, or at youth centers? And what efforts have been made by this organization, means ISSUP, to ensure provision of awareness, especially to school-based youth? What are the right place where a person can learn youth about drug abuse effect? Is it school, home, or youth centers? And question number 2, what are the efforts that has been made by the ISSUP Tanzania to ensure provision of awareness, especially to school-based youth? Dr. Cassian?
Okay.
Oh, Isaac can proceed. Isaac can proceed.
Okay. So I think that I can tackle the first part of the question. Where is the best place? So where's the best place can be really responded by the insight of preventive interventions, or the preventive science. Maybe you might say home is the best place, but then is the science agreeing to that? Or is the research and what we are seeing agreeing to that? So if you see what Damaria's the previous session that we went through, you'll see there are some intervention targets home place, some intervention targets school place, and some intervention targets community level. So I would say they are equally important when it comes to substance use prevention, and they are designated intervention that will show you how talking about substance use at school is best on prevention of substance use to youth, same to home setting, and same to community setting. So I would say you can't say there's the very best place, but at the same time, every place might pose a risk of substance use to you. So we need to spread the knowledge to both places, and youth has to be able to access this knowledge and information about substance use from all the settings. The second part, I think Carson will be in the best position to respond to that, but also as a part of ISSUP management, or ISSUP leadership, we have done several efforts spreading the knowledge and about substance use in school setting. We have conducted more than one training to school teachers on the universal prevention curriculum. We have also have some events that have designated to increase the knowledge and awareness of substance use to students and pupils at schools. So we have come up with several ways of tackling, of making sure that our students at school have enough and adequate information about substance use. So training the teachers, but also we have events, we have sessions that we have integrated as ISSUP to make sure that youth can access this substance use prevention. Yeah, so maybe if Cassian has more to add on that. But basically, this is what we have been doing for more than 2 years now.
Dr. Cassian, do you have any addition, or can I give you the question and put your addition from the question? Because
no,
here is the question.
No. Isaac, can you proceed? I don't have voice anymore. My voice is gone.
Okay. Let me pose another question to Dr. Isaac. And Ms. Damari, if you are available, so you can answer. Cigarettes in Tanzania. This question from Abdul Karim Ramadhani. Cigarettes are labeled as harmful to health, and Dr. Cassian tried to explain to us about the substance use, the meaning of substance use, psychoactive, and the cigarette and the alcohol labeled as harmful to health, and yet industries continue to produce them. What strategy do you have in place to ensure the use of cigarette and other addictive substances like alcohol, cognac, Keivanti, and other can be reused in order to protect the health of our youth?
Okay, so I think that question is, yeah, so that question is more of a drug policy conflict or of interest. So we have, like, I would say it's more of a policy, the conflict of interest is more on a policy level. So we have policies that support the production of tobacco and manufacturing of alcohol in our setting, and tobacco and alcohol are legal drugs, but still they have regulations that really take care of the production and the supply of these drugs as legal drugs. But also when it comes to the, we as addiction professional, we know regardless of whether this drug is allowed, legally allowed in the country or not, but still they have the pharmacological properties that falls into psychoactive drugs and might pose a physical and psychological hazardous effect to people. We need to advocate for the better policy. But also we have programs for prevention, as I say, like DCA, Drug and Control Enforcement Authority, is doing a lot to make sure the policy that really regulates the substance use, both the legal and the illegal drugs, are followed and implemented. Also, we have other government agencies that are taking care of that. And also from the community level, we have NGOs, CSOs, civil society organizations that are advocating for the better environment to make sure that youth are not engaging in substance use. So there are multiple levels of intervention and multiple interventions that are in place right now. And really, if you look at the records from Tanzania, from Drug Enforcement Authority, but also from the Ministry of Health, you will see substance use, be it legal and illegal, is going down in our country. So yeah, so there are a lot of efforts that have been posed. There might be some issues when it comes to the harmonization of these reports, but still we have good reports that things are getting better with time. Thank you.
Okay, thank you so much. We have another question here. Few minutes remain, but let us proceed with few questions, then we'll close the session. Thank you everyone for your comment. I will read three or two questions, then we'll close. Let me read here. Dr. Isaac, what happened when codeine or cough syrup is mixed with the Sprite? We have seen a lot of youth in different countries in Africa or at global perspective. They've tried to mix different issues. Maybe others mix different inhalants such as glue. Maybe you try to use energy drinks with this, paracetamol, this and this and this and this. So this person from Kenya tries to ask about the experience in Kenya where different youth try to mix between cough syrup and the Sprite. So in Tanzania, it might be Coca-Cola and paracetamol, energy drinks with the any issue. So can you give us more explanation about this kind of mixture? Maybe it might be really harmful compared to other kind of drugs.
Okay, thank you very much for a very good question. I really don't have a clear response to that. I'll just use my experience, my medical experience on this. So I really don't know what's happening when you mixed coffee syrup with Sprite or any other drink, but this has been a common practice. Like in Tanzania, we have seen people are using mixing energy drinks with I think some of the pills, I'm not very sure about what kind of pills, and they have their own purpose of doing that. They say if you mix these two substances, then you can sleep easily, or you have energy to work out very well, and or maybe some of them are using for intimate kind of purposes, so maybe yes, things like that. So when it comes to coffee and Sprite, what I know is the coffee contains this. Coffee is more of a stimulant. The caffeine is more of the stimulant, and maybe Sprite has a lot of sugar. So all of these substrates might maybe the mixing of the two might make a person to be more energetic, and perform any task he think by mixing these two substrates might fit him to do. So the coffee, the science behind here is the coffee. The coffee is a stimulant. You drink coffee, you get more energy, and more active, and Sprite is more sugar. So the sugar also makes people more energetic. So I don't know what comes out from it, but from this background knowledge, I think this might be the reason why they mix it. I promise to make follow up on that, and maybe next time I would have a proper question. I mean, a proper response on this. Thank you.
Okay, because of time, we don't have enough time. A lot of questions have been asked in our chat, and the time is not enough. We'd like to end our session on 7:30, so we have only 3 minutes remain. So thank you, everybody, for your contribution from the participants, from the key speakers. So in the closing of our session, I would like to remind participants who would like to register themselves or not yet joined in ISSUP. So you can visit the website of ISSUP Global and register yourself as a global participant. Also, can you communicate with us in Tanzania to join our ISSUP Tanzania chapter? We still invite more people to attend the session. Different session will be organized from today. At least every month we'll have 1 session. So make sure you follow our page at Instagram. So we have a lot of issues which we try to build up, then we'll announce in our pages. So make sure you follow us in Instagram account. Also, you register yourself in ISSUP Global and also in ISSUP Tanzania chapter. But also, if you have any question individual, maybe we can provide our numbers or our email. You can text us through our email or through our normal number, then we reply, because I've seen a lot of questions. But before closing the session, we would like also to provide information that all learning materials such as slides will be sent to you through your emails. So through your 48 you will get certificate, also you'll get learning material. So within 48 hours, always 2 days, within 2 days you will receive the certificate and learning material. For those who are asking about learning material in the slide, also for those who are asking about the certificate, will be sent to your email within a period of 3 days. So thank you so much for your contribution. So before closing it, Dr. Kasia Nyandindi, the ISSUP chairperson of Tanzania chapter, do you have any concern, any comment, or any closing remark?
No, you can just do it. I've just done my part, and then you as a coordinator can just finish up. Thank you. Thank you for the organization.
Thank you a lot. Dr. Isaac, as the secretary of ISSUP Tanzania chapter, do you have any closing remark from your side?
Just to thank the participants and showing up to these sessions, and we appreciate the coordination of ISSUP Global and the good work that you did, and the way our chairperson made sure this is happening. Thank you very much.
Okay, Ms. Damali, if you are available, do you have any closing remark?
Okay, I would like to say thank you for the participants and the organizers for these sessions. We do appreciate their comments, questions, and the clarification from the presenters. And I think in the closing remarks, we have to take care of our youth and the children because of the future to prevent them from substance use. Thank you very much.
Thank you a lot, all presenters, Dr. Isaac, Dr. Kasia Nyandindi, and Ms. Damali. As we conclude, let us remind that prevention or preventing youth in substance use is a shared responsibility. It's not a responsibility of ISSUP or DCA or any person. It's a shared responsibility. Everyone must be responsible. Together we can prevention for all. Through informed communities, open communication, and supportive environment, we can help young people to make healthy and safe choices even during this high risk season of holiday season. So together we can. Thank you very much for your time. Let us meet in another session. Thank you a lot for your time. Goodbye.
Thank
And
you.
thank you a lot
Bye.
also, ISSUP Global. Thank you so much.